Hello there, this is Nathan Wright with Medi65.com. Today I want to talk about the differences between Medicare Advantage plans and Medicare supplement plans. Make sure to subscribe to the YouTube channel here. Okay, so let's get to it. Medicare Advantage versus Medicare supplement. So you might be thinking all these different terms, Advantage, supplement. I don't want to be pigeonholed into any different plans, and the purpose today of this video is educational. So by the time we get to the end of this video, you will understand the differences between Medicare Advantage and Medicare supplement plans. So the first one we're going to cover is the Medicare Advantage plan. So a lot of times you will see a Medicare Advantage plan. You will see them advertised with zero premiums. Not always zero. There's some that are $25 and on up, but commonly in the larger cities, you will see zero premium Medicare Advantage plans. Most, not all, but most Medicare Advantage plans have a prescription drug plan built into it, and that's included at no extra charge. Most Medicare Advantage plans they're going to be kind of like your plan that you're coming off from in your typical work environment, either HMOs or PPO plans. There is a network. Now, the difference between an HMO or PPO, HMOs are typically smaller, localized within it could be a major city, but it is nonetheless a concentrated network, whereas a PPO typically is going to be like your nationwide type networks. Enrollment. So you can enroll in a Medicare Advantage plan once a year during open enrollment or at a life change, such as turning 65. Deductibles. On average, you're not going to see a deductible on a Medicare Advantage plan. Some I have seen with a small deductible, but on average, you won't see a deductible on a Medicare Advantage plan. Now, here's where it comes into, you say, well, what's the trade-off? I've got a zero premium, so what am I going to have to give up for that zero premium? Because it's very true, you can get a zero premium Medicare Advantage plan, but you're going to have copays. So what does that mean? You see your doctor, primary care physician, sometimes I've seen zero copays, $5 copays, $10 copays, $15 copays. You see a specialist, it might be a $10, $15, $25, $45. They're all different depending on what plan that you go into, but there will be a copay, and you cannot spend, though. There's what's called a max out of pocket, and each plan is different. You cannot spend so much in copays per year up to that max out of pocket, and each plan's different. So you would have to find out what each specific plan's max out of pocket is. But at any rate, you're going to pay copays when you use the Medicare Advantage plan, not unlike your group or work plans that you may have now. There is, in most Medicare Advantage plans, you're going to find built-in vision, dental, and hearing. Now, some have more benefits than the others. So it's very important to look at those benefits and see. And some folks may say a hearing benefit is great. Other folks might think, well, I couldn't even use a hearing benefit. So really, it pays to look at the individual plan as to what it has or doesn't have. So, and then most Medicare Advantage plans have a free gym membership built into them. Just kind of an extra thing that they throw on. So that's the Advantage plan in a nutshell. And then a Medicare supplement plan. Now, the premiums on the Medicare supplement plan, they're going to range anywhere. Now, this is just an average here. So $100 is when you're just getting onto Medicare is a good average. I've seen lower. I've seen 89. I've seen $79. This will also depend on what kind of plan you choose. So I'm not going to go into the plan details in this video. I do have other videos that will go into the specifics of different types of plans, but there is a G plan, an N plan, and then F is a plan that was grandfathered out. If you're new to Medicare starting in January 1st, 2020, you can no longer enroll in the F plan, but they're still out there. Some clients still do have the F plan. But typically the premiums are going to start off in the $100 range, depending on what kind of plan you get. And I will say this, they do go up as time moves on. As far as a prescription drug plan, you would need to add an additional prescription drug plan. Now, those I've seen as low as $14, $15 a month. Some of them are as high as $70 a month. That is something that you would need to look at on an individual basis, because everyone takes different prescriptions. So, depending on your prescription level, that would be what plan would be probably the best for you. But on average, we're saying between $15 and $30 for a prescription drug plan. And one other thing I want to kind of point out with the prescription drug plan, there is a penalty if you enroll into Medicare Part A and you don't have credible coverage. That's the key. Now, if you're still working and your work insurance is credible coverage, which most are. I can't as a blanket rule say that they all are, but most are. If it's credible coverage, you would be exempt from this penalty. But if you're on Medicare, at least Part A, and you don't have any kind of drug coverage, you'll be penalized when you go to add a drug plan. Most people think, well, I'm not penalized. I've run into folks before and they're like, well, I've had Part A and Part B for 20 years and never had a drug plan or an Advantage plan, and I've never been penalized. What happens is once you enroll, they add that penalty on, and it's a monthly penalty you pay as long as you have a prescription drug plan. So it's very important when you first get onto Medicare, get your prescription drug coverage either through an Advantage plan or a Part D drug plan. So enough about that. The nice thing about a supplement plan is there is no network. So you don't have to worry about if you go this side of the fence, Medicare supplement, is my doctor in network? Do they take this? Do they take that? Wonder if I travel, etc., etc. As long as they take Medicare. Now, there are a few doctors out there that don't take Medicare, believe it or not, but they're very rare. Most doctors do take Medicare, and if they take Medicare, by law, they have to take your supplement, because a supplement plan is really your original Medicare is in first place, and the supplement just comes in and fills in the holes that original Medicare doesn't cover. Another word for Medicare supplement plan too is Medigap. You'll hear that as an old term, and I said earlier, fill in the holes. Well, Medigap fills in the gaps that original Medicare doesn't cover. So anyway, there is no network as long as the doctor takes Medicare. You can go anywhere in the continental, or actually in all 50 states, you can go anywhere that takes Medicare and you'll be covered. Okay, so here's an important thing to consider. So if you change or go into a Medicare supplement plan, there is going to be health underwriting. And what does that mean? So that means there's going to be some underwriting questions. There's going to be they're going to look at your medical history. They're going to look at your prescription history to see if you actually qualify for a Medicare supplement plan. Now, here's the catch, though. When you turn 65 or you just newly enroll in Part B of Medicare, you're in what's called an open enrollment. So that rule doesn't apply at the time. So you can get in without health underwriting. But if you wait until after the time period, then you would have health underwriting. So on the other side, on the Medicare Advantage side, there is no health underwriting. You can change your Medicare Advantage plan once a year without health underwriting. So that is something very important to consider when you're going between the Advantage and the supplement plan. So deductibles. So like I mentioned, the Plan F is going away. So the Plan F was nice because it didn't have a deductible at all. But the premiums were higher. You paid, you might have been closer to the 125, 150, whatever, depending on the company. And by the way, when you shop companies, it's important to know that all G's, F's, N's, whatever the letter designation is, it does not change from company to company. Basically, a G is a G. Now, they can charge different premiums, different prices, and they do. So that's why it pays to have maybe an independent broker look and shop the best plan for you, because they are literally structured all the same. They just have different prices. And some companies have a tendency to go up in price more than others. Just something to kind of think about when it comes to your Medicare supplement plans. But the deductibles, typically at the time of this recording, it's March 31st, 2020. And the Plan G, or the Part B deductible, I should say, is at $197 per year. Once you meet that deductible, you don't have any more deductibles for that year. Copays, this is the nice thing about a supplement plan. There are no copays. None. Okay, so basically you're going to go to your doctor once you meet that deductible, or you go to the hospital, and the hospital's on the A side of Medicare, so you wouldn't have to meet the deductible. But the $197 that I just mentioned, that's on the B side. So you pay that when you go see your actual doctor or clinic or what have you. So once you meet that deductible, no copays whatsoever that year. So your out-of-pocket is the monthly premium, basically both monthly premiums, the regular plan premium and the prescription drug premium. Now, there is no vision, dental, and hearing with original Medicare. So in turn, there is no vision, dental, or hearing with a supplement plan. There are a couple companies that throw in a few little extra things, which I said before that they're pretty much all the same from company to company. There is a couple companies I can think of. One has a little eye thing they throw in, and a couple other companies throw in like the gym membership, like the Advantage plan does. But in general, most Medicare supplement plans do not have the gym membership. Like I said, there's exceptions to every rule. There are a couple companies out there. And that's why it does pay to talk to a licensed broker that knows their way around these different plans, that can tell you, which companies have what, and navigate through the waters relatively quickly. So in summary here, Medicare Advantage, now I'm looking at kind of the, monthly out-of-pocket that you would have premium-wise. So many plans are at zero, as we've already discussed. So you're going to pay little to nothing on a Medicare Advantage monthly. Now, you are going to pay when you use it, as we just discussed. Copays, usually when you see a doctor, those are the smaller copays. When you have an overnight stay in the hospital, those copays are going to be a little bit larger. Some in the $300 to $350 a night. But there's ways around that too. So there's ways around paying the hospital big copays, but that's another video for another day. The Medicare Advantage does include the prescription drug plan, and they do include vision, dental, and hearing. There's one plan I can think of that has $1,500 a year. Now that's at the time of this recording. Again, March 31st, 2020, this recording is being made. But there is one I can think of that does have $1,500 a year that covers everything but cosmetics in dental. So there is vision, dental, and hearing built into the Medicare Advantage plan. So on the supplement side, as far as what you might be getting into, the summary, I should say, $100 to $125 that you pay when you first join the plan. But I do want to throw in there, it does go up. I have met with seniors before that have had supplement plans for 20 years and their premiums are $350 and $360 a month. That's something that a lot of folks that are just going to lean on this side aren't going to say a lot about, that the premiums keep going up on the supplement plan. There is little out of pocket and the small annual deductible that we've already discussed. You do need to purchase a separate drug plan, and you can purchase a separate vision, dental, and hearing plan. So what is all this going to possibly cost you per month? Again, this is just estimates. Every company is different, and with my company, Medi65.com, we're brokers. We represent every company out there. Oh, and best of all, our service fee is $0. We don't charge you anything for our services. So anyway, Medicare Advantage plan is not going to cost you anything. So Part B, though, Part A of Medicare is the hospital. Not going to cost you anything a month on average. I say on average because sometimes income limits can be a little bit higher, or you didn't have enough work credit history and you might pay something for Part A. But on average, as a general rule, Part A is not going to cost you anything. Now, Part B, at the time of this recording, March 31st, 2020, is $144.60 a month. So if you went into one of these zero premium Medicare Advantage plans, you're going to pay a total of $144.60 per month. Contrast that with a Medicare supplement. So the Medicare supplement plan, let's just say $100 on average. That's what you're going to start with. I just kind of pulled a number out of my hat here. Drug plan, $21. And then let's just say you go ahead and opt in for a vision, dental, and hearing plan. That's $35 a month. That's just an average. Some are more, some are less. And then, of course, it doesn't matter if you go Advantage or supplement, you're going to pay the $144.60 a month. Unless, now we'll just kind of throw this out, if you are in a certain income bracket where you get the state to pay for that, there are those income brackets that, and if you have any questions on that, feel free to call me. Nathan Wright, 615-823-1322, and I will put my number up on the screen again in case you didn't catch that. So in this example, you're looking at $300.60 per month. Now, if you ask me which one should you choose, at the beginning, I'm not going to say do this or do this. It's personal preference. The way I usually kind of, I know I did a lot of talking there and a lot of things came up on the screen here, but just to make it very simplistic, do you want to pay when you use it, or do you want to pay the monthly premium ahead? Okay, some folks are more comfortable paying this per month, and they have the security of knowing, all right, my medical expenses, although I have a little bit higher on my premium, I don't have to worry about anything. Other people are a little bit more, could we say risky? Maybe. It might, but they're like, you know what, I'm pretty healthy. I'm going to take that risk. I know if I went into a supplement later in life, I'd have a health assessment, but I'm gonna go with the Advantage. It's kind of like my work plan. I got a PPO or an HMO or whatever you choose. And, and then I'm going to do it that way. Now, like I said, there's ways of lowering the copays through what's called hospital indemnity plans. But, you can do that. Like I said, that's another video for another time. So at any rate, if I can help you at any point My name is Nathan Wright, Medi65.com. Phone number 615-823-1322. And please subscribe to my YouTube channel. Thanks so much.